And we're live. Welcome everybody to InHouse Physicians COVID-19 vaccine webinar. We're going to shed some light on how large organizations can get access to the COVID-19 vaccine for their populations and not have to wait months for everyone to get vaccinated. Joining me on the webinar is CEO of InHouse Physicians, Dr. Jonathan Spero, and Christina De Jesus, nurse practitioner and director of clinical operations, and more importantly, the head of InHouse Physicians COVID vaccine program. Christina makes it all happen. InHouse Physicians has been an employee healthcare company since 1992. We've been working with some of the largest organizations to promote health security within their employee populations. At the beginning of the COVID-19 pandemic, we started testing the employees at these large organizations. And by the end of the summer of 2020, we were experts. And then in November, we started to file applications to obtain the COVID-19 vaccine, and our team learned how to navigate the state and local jurisdictions to be able to get the vaccine. And it's a very, very intensive process, and we're going to cover what some of the strategies that we've been using successfully to access the statewide immunization information systems, which are very involved, and it's different state by state. So here are some of the challenges for a large organization and employer to get access to the COVID vaccine for their population. Number one, approval. Having to navigate the state and local jurisdictions to file an application. You need to attach a provider like InHouse Physicians that has medical directors in all 50 states, all the appropriate medical licenses, having cold storage capabilities. So this is a really big part of preventing many companies from accessing the vaccine. And then the logistics, being able to work with your local county health departments to be able to see if they have enough vaccine available for your organization to host a closed pod. And so here's the distribution of the COVID vaccine now. So the federal government will hand over the allotment of vaccines to the state, and then the state distributes those to the counties. And it's up to the counties, their accountability process and eligibility criteria to decide who receives the vaccine within their county. And there are significant rules and there are significant impediments for many private organizations to access this vaccine. At least to date, at March 15th, when we're recording this webinar, we have demand that's exceeding the inventory. So we think this is going to change as we move forward. But right now, there's some pretty strict eligibility criteria that's in place that we're going to cover. How do your individual sites qualify to receive the COVID-19 vaccine? Well, number one, you want to make sure you have a minimum of 500 lives or more. The accountability process that's in place by the local county health departments across the United States is looking at 500 lives or more. Anything less, and you probably won't get the vaccine. And the reason for that is if you open the vaccine, it's only good for 6 hours. Most of the vaccine that is being distributed is towards larger vaccine clinics. So you want to make sure that you at least qualify by the eligibility criteria of your local county health departments. And what we're seeing and what we're hearing is to have a minimum of 500 lives. If you don't have that many individuals at your sites and you have a multi-state footprint, which is very common for large organizations, there are two solutions that you may want to consider. Number one, Philanthropy. This can allow you to donate InHouse Physicians medical services to administer jabs to the local public. So whoever's eligible in a particular county, you can hire InHouse Physicians to organize the event on your site and then invite the public to come in and get vaccinated. And this will definitely help to strengthen your relationship with the local county health departments and to help make sure more individuals in your county get vaccinated so that when it's your turn for your employees to receive the vaccine, you have a better chance of being able to get the vaccine for your employee population. The second solution is partnering with other local organizations within your county, other large businesses or corporations. If you're in the same industrial park, you may want to make some phone calls and network and see if they would be interested in hosting an employer-sponsored COVID-19 vaccine clinic. So this is the prep work that our team has to go through in order to get the vaccine for your employee population. Number one, we have to apply with the state on behalf of your organization, and that includes putting in our medical licenses, making sure that we have cold storage capabilities, and that we can demonstrate that on the applications. If you have 4 individual sites in one state and you want to have 4 separate COVID clinics, then that would be 4 separate applications. And the application process we're going to cover is a very involved process. Once we successfully get access to the statewide immunization information system, and then we've filled out all the proper paperwork, and we'll cover what that entails, then we can hopefully receive access to the vaccine, and then we can schedule the vaccine clinic for your population. We'll send out a link. We'll create an email template, which you'll push out to employees, which will allow them to register, sign a waiver and consent form, which allows our team to share their health data with you and the local county health departments. And so once we successfully choose a date for the COVID clinic, then an employee will show up, and our admin will make sure that they filled out all their paperwork. In many instances, some employees will show up and they don't fill out their paperwork or sign their waiver and consent form. We'll have a way to respond to those employees and make sure everything is filled out properly. It takes about 3 to 5 minutes to register, and then the employee will then get vaccinated by one of our nurses. This takes about 3 minutes. And then they'll go to an area where they're monitored for about 15 minutes. And then we make sure that there's no adverse reaction to the vaccine. They're given a takeaway form and access to our telemedicine hotline. Invariably, they're going to experience some symptoms as their immune system reacts to the vaccine. So our nurses will be able to guide them on what symptoms are concerning, what symptoms are more common with the vaccine. And so application fee costs, we get the question of why do we charge for the applications? Well, number one, it takes about 60 hours on average to file a state application for the COVID-19 vaccine. It's a very involved process. We got to register with the statewide immunization information system, and then we get access to the state's immunization program. Next, we got to enroll as the provider, and then this gives us access to the CDC provider agreement, and then we establish a contact with the local county health department, because it's up to the local county health authorities to decide who receives the vaccine and who doesn't. And a large organization that may be at phase 1C is going to be less important to the local county health department than the public at large that may have not got vaccinated when the first couple of phases have come around due to the shortage of the vaccine. So this is where we're going to see some delays. So getting a contact at the local county health department, in many instances, if you're one of the largest employers in your county, this can really help so we can collaborate together to get those conversations started, build those relationships, so that we can receive the vaccine for your employee population when it's your turn. And then part of the application process is training. Many of the fields within these applications have to do with training and safety protocols that our medical directors and medical team have to undergo in order to get approved. So it's a very involved process. And in all transparency, we weren't charging for applications at first, but then we found that there was consistently 60 hours on average to be able to successfully file an application and get everything in place. Anne asks, how are the vaccines distributed?
Okay, so as you talked about earlier, Thomas, the vaccines are distributed to the state level from the government, and then they are allocated on the local jurisdictional level. And usually this is based on population. So at the local jurisdictional level, they're able to see how many vaccines they actually have access to as a county, and then they decide how many are going to be allocated to each eligible population, and that's how we will get the distribution to these sites.
All right, and Lisa asks, what are the eligibility criteria for qualifying my company's individual sites? Great question.
Well, as you've been alluding to for a number of slides here, that the more people you have at a site, the more chance of getting approval to get distribution to your site. So we've seen more recently around 500. However, in the future, that might get lower. There's also some states that probably already are offering it to sites that have lower, but in general, 500 vaccinations or more is what we're looking at. You might get approval to get vaccine, but you may not get access to vaccine or be eligible to access to vaccine because your population is not at the right tier. But again, over the coming months, that's going to change, and it's going to be wide open to everyone. So that should be a big issue as well.
All right, and Samantha asks, Who in my population gets vaccinated first?
So this is a good question, and it's something that, again, varies significantly by state. But essentially, what happened early on in the pandemic is the vaccines were allocated to the critical essential workers such as healthcare workers. And what we're seeing now is that a lot of states are opening it up to 1A, 1B, and now moving into 1C. But what we can do as IHP is we can reach out to the local jurisdictions and work with our clients to pass on their information and their roles and responsibilities over to the Department of Health, who can then pass that information on to the adjudication teams, who can give you a solid answer on what your eligibility actually is and what phase your industry actually falls into.
All right, and AJ asked, does vaccinating eliminate the need for testing? Great question.
So if you've been exposed to someone who has COVID, you don't need to quarantine anymore or get tested unless you have symptoms. So if you're asymptomatic and you've been exposed to someone who has COVID, there's no need for testing unless you've had symptoms.
Diane asks, can spouses get vaccinated?
So the short answer is yes. A lot of our clients do request to have their spouses and dependents vaccinated. And as long as the spouses and dependents are within the local jurisdictional eligibility criteria, then yes, they can get vaccinated.
All right, and Rebecca asks, what if my employees live out of state?
So again, another thing that can vary by state, but in general, the rule of thumb is that if you work, live, or study within a certain county, you can get vaccinated there. So what we have seen is when people maybe live by the border or live in the tri-state area, they can get vaccinated in another state as long as they work or study there.
Makes sense. That'll probably come up a lot with employees living near borders and traveling. So Judy asks, what type of cold storage is required for the vaccines?
So that's a good question. So each vaccine has different cold storage requirements. The most recently released Johnson & Johnson vaccine can be stored between 36 to 46 degrees Fahrenheit for up to 3 months. For the Moderna vaccine, it's the same temperature requirements, but only for up to 30 days. And for Pfizer, they kind of loosened the regulations for cold storage. So you can store the Pfizer vaccine between -13 degrees Fahrenheit to 5 degrees Fahrenheit, all of which IHP has access to, and our staff are trained to handle all of the vaccines.
Excellent. And Christine asks, will everyone get vaccinated at the same time?
So as of right now, the way that the local jurisdictions are releasing doses is we can request a certain amount of doses, but based on the amount that they actually have, they'll go ahead and release however much they can release to you. So if you request 800, some weeks they may only be able to allocate 600, for example. So in general, no, not everyone will get vaccinated at the same time. And what we actually suggest to a lot of our clients is that they come up with a prioritization plan that they can implement, which will allow them to get their high-risk employees vaccinated first, and then allow that to trickle down as more access becomes available.
All right, and Elizabeth asks, do you have any minimums to come on site and vaccinate our employees?
Yeah, so right now we have tried to focus our efforts on companies that have at least 500 vaccinations that they're going to be giving. And when you think about that, you're actually, if you're looking at maybe 60% of the population getting vaccinated, then you're going to have more than 500 employees or spouses or total lives to reach that 500. So as far as absolute minimums, when the counties and states are able to start, or do at some point start, offering these on-site COVID clinics for smaller employers that may only have a couple hundred, then we will consider that. There may be additional fees, setup fees involved to provide that service because of cold storage and so forth, expenses and shipping expenses for those smaller sites. So right now, I would say that absolute minimum is probably going to be around 200, where we probably aren't going to go below 200. But if below 500, there will probably be additional fees involved.
Fantastic. I don't think we have any other questions. So thank you so much, Dr. Spero and Christina, for answering all these questions and providing your medical expertise to shed some light on the COVID-19 vaccine. If anyone watching this is interested, would like to learn more about what InHouse Physicians is doing to secure the vaccine for private organizations to host an employer-sponsored COVID-19 vaccine clinic, please reach out to your local sales representative and they'll be able to do a demo for you, discuss how we're getting the vaccine and how we're operationalizing everything. And we'll also have possibly Dr. Spero or Christina available too to answer any specific questions that you may have, especially that are medical in nature. So thank you everyone for taking part in InHouse Physicians COVID-19 vaccine webinar. Thank you.